Hello, my name is Keith Denning. I'm the Chief of Staff of Insight Chiropractic here in Flint, Michigan, and I'm here with our patient Vanessa Davis to discuss the MUA procedures that she's had done recently. Hi, Vanessa.
Hi.
I'd like you to be able to describe your pain issues that brought you to Insight originally.
Well, what originally brought me to Insight is I was in a really bad car accident in January of 2020. I was in the hospital 8 days, and then I spent 2 months in the healing center here at Insight. So all of my recovery and procedures have been through different doctors within Insight, with the physical therapy, chiro, everything. When it comes to chiro, in the accident I broke my L1 vertebrae, and my hip was displaced, and I had other issues in my lower back as well, as well as a problem with my right shoulder. Yeah, when I first came to Insight, I was a big mess. That accident definitely changed my quality of life. There was not a day that went by that I wasn't like in excruciating pain when I first started coming here. But with the different procedures and adjustments that I got here, I can say that most days now are like 90–80% better than when I started.
Excellent, excellent. So the MUA procedure itself, what were your first thoughts when you heard about the procedure?
Well, I'm not gonna lie. It was a little scary when I heard about manipulating your bones under anesthesia. I was a little on the fence about the procedure, but I knew that I wanted to avoid any kind of surgical or injections into my back if possible. So I came to the consultation, and figured I'd see what you had to say about it.
Hopefully we made you feel a little more comfortable after the consultation.
Definitely after speaking with you about the procedure and you explaining it a little more in detail, I was a little more at ease. I was still a little antsy about it the first time, but I was a little more at ease.
Good, good. Can you describe your experience with the procedure itself? Maybe run somebody through what the actual experience is like.
Okay, well, I showed up here at Insight, and the place that they took me to it looked almost like a hospital room, but there were multiple beds and curtains and whatever. And the nurse come over, and she basically went over all of the information that was needed to make sure that, first that I hadn't eaten anything in so many hours, and then, just went over all the paperwork and explained a little more as to what was going on and how the anesthesia was going to work. And she was really nice. I honestly can say I've never had a bad experience with any of the nurses or staff here. Like, everybody here is just like awesome. I love them. But once she explained it, they had me relax in the bed, and they took me back to the room where the anesthesiologist explained to me again what was about to happen. And I forgot, the nurse did the line, like a IV line. Right. Went back, and he explained it, and then started with the anesthesia. And honestly, I don't remember more than a minute after that.
Makes sense.
Next thing you know, I was waking up. It seemed like I had just fallen asleep, and I woke up. And like I said, the first time, it was a bit scary waking up because, it was a new experience.
Of course.
And I was feeling things that I didn't feel, because I guess from the moving of the different joints and bones, everything felt a little too loose for me because it was a different experience. I mean, but the nurses and the doctors were so awesome about like explaining everything and making sure I was comfortable and
Excellent.
getting me
Well,
what I
that's good to hear.
needed so that I didn't feel it so much.
That's good to hear.
And just explaining to me like the recovery and what I needed to do. And
So after that initial recovery period, where would you say you were pain-wise? Was it a small improvement? Was it a large improvement? What would you say your pain levels were afterwards?
I would say the first time,
The first time you had the procedure?
the first time I had
Okay.
the MUA, because I've had it. This will be my fourth.
Okay.
I'm coming on my fourth one. But the first time I had it, there was a small improvement. I won't say it was huge, but it was maybe going from a normal 8, 9 sometimes in pain to maybe a 6,
Okay.
7. And then a few weeks later, I had the second procedure. Now that one was like, that made all the difference in the world. That second procedure, the recovery was a lot quicker, and I can say I went from like, usually like most days, having 8, 9, and then to 7, 6, to where it was like, oh, I don't know, maybe this is like a 4, 3, you know, some days were decent, you know. I didn't take as much of my PRN medication as I was taking, you know. I never increased as far as my Medicaid pain medications while I was going through this. All I could see was a decrease, which I was happy with because I never wanted to be one of those people who are just dependent on medicine, you know, pain medication to just be able to function. But I say that third procedure, now that was the one. The last procedure I had, it was so crazy because when I woke up, I was pretty much feeling normal after. It was like not really I maybe took the one day to recover.
Yeah.
And the next day I'm walking and I'm like, wait a minute, my back's not hurting. It blew my mind. Like,
So when you say normal, you're talking almost like pre-accident status.
yes,
kind of
yes.
feeling.
It was
Excellent.
really close. I mean, I still have days where, you know, I still feel the pain and whatnot, but it never gets to the point where it's like debilitating like it was before. Like, it went from I couldn't walk more than maybe less than half a block without like having to stop and sit because of the pain in my lower back. To now, I can do a couple blocks fine, and I might get a little tightness, but we're working on that.
Very good.
But my pain from going from starting out in an 8, 9 level, now most days it's maybe a 2, 3, and sometimes, you know, it's not even that.
I love hearing that. I love hearing that. So is it safe to say that this is a procedure that you would recommend for patients that are experiencing low back and neck pain?
Oh, definitely. This procedure, I tell everybody, I tell everyone about it. Like any friend, family member that I know that have issues with their back, or even if it's chronic issues that they've been dealing with, or if they hurt their back, I'm like a number one advocate. I'm like, hey, you need to go to Insight. Like, you really need to check out Insight, because I mean, I can't even express how much they've done for me. Like, as far as since my accident, like it's been such an improvement, and I'm so grateful to have been introduced to Insight. But I recommend it definitely to anyone, especially if you have been dealing with something for a long time in your back and you don't just nothing's working, you know, because I've been through that. Like, I've been through the injections before. I've been through different pain medication, muscle relaxer. I've been through it all, and nothing worked for me like this procedure. Like, nothing I've ever been through with my back and, you know, issues. I've never had anything work like this. So I would definitely recommend it.
Excellent. Well, Vanessa, I really appreciate you joining us and letting the world know all this information and how you've progressed through this procedure and how it's affected your life.
Well,
For
thank
the better.
you, and I thank you guys, like, all the time.
Thank you. Thank you for joining us today on our patient feature on the MUA procedure. If you have any questions on the MUA procedure, please visit our website at iinn.com or call us at 810-275-9366. And please be sure to follow us on our social media.